This is Wanda Rose, faculty member at North Dakota State University School of Nursing, and I am going to be presenting on two components of the evidence-based practice. The first is searching for the evidence, and the second is doing a critical analysis. So once you have developed the PICO question, you have to identify what type of PICO question you are trying to answer. Is it an intervention or a therapy question? Is it an etiology question, a diagnosis question, prognosis question, or meaning? By identifying the type of question will lead you into the type of research literature that you should be searching for. The next slide, you need to determine the level of evidence. You use a hierarchy of evidence scale. Oftentimes they are a pyramid starting out with a systematic review being the top level, moving down to an expert's opinion. Oftentimes you can find this in the literature. Feinholt and Overholt have a very well developed level of evidence. So you would use this to determine the level of evidence. The next slide identifies where to find the evidence. So once you've identified the type of question and the level of evidence, the best place to go is you would use relevant databases. PubMed includes the Medline. This is one that is available, and it includes all of nursing plus medical literature. The other for nursing is CINAHL, which is the Cumulative Index to Nursing and Allied Health Literature, which is very comprehensive for nursing literature. And of course, if you have access to the Cochrane database, which includes systematic reviews, which is really the needle in the haystack, if you're able to find a systematic review on the content that you're looking for. The search strategies, which is the next slide, is looking for the key words. And that comes from that PICO or PICOT question that you've identified. You combine the words, and really you would identify the key word from the P, which is your population or problem. You would identify I, which would be the intervention that you are looking for, and a comparison. Sometimes you will not use the comparison, as you will learn from developing the PICO question, and your outcome. And you would identify those keywords by placing it into the search strategy that's available. You can also limit that search based on the age. So if it's just infants, or if it's elderly, or if it's male or female, and you can also, in your search, you can limit the type of articles you desire to obtain, such as a random control, or you can put a parameter around the year. And that should begin your search strategy. After you've conducted the search and you find the articles that match your PICO question, you want to do a critical appraisal of the evidence. So when do you appraise something? Appraisal takes place usually when there's high stakes decision. And so when you have the articles and you want to change practice, nursing practice, that's a high stake. As well as you also do it when you're helping to find out a solution to something or determining what is of value. So for example, when you appraise something, if you're going out to buy a new car, you're going to appraise to find out, does it have all the components that you're looking for? Does it have the value that you're looking at? For instance, if you're looking for a home, is it the value that you want to pay the money for? Does it include everything you want? Or even another big appraisal is maybe when you purchase an engagement ring. So all of those have value and they have high stakes, no different than we are evaluating the evidence that you've obtained through doing your search. So what is a critical appraisal? Well, it's a process of exactly looking at and determining the work or the value of the research evidence or the findings that you've obtained. You evaluate it, you're looking for validity. You want to know, are the results relevant to the clinical decision that you're going to make based on that PICO question. The next slide is, what is critical appraisal? Well, again, it's worth or value. So validity. You want to look at how well was that research study conducted. Did it include all the components that a research study should include? Were the results reliable? Can you use those results? And can you use those findings to make the decision you want based on that PICO question? So the next slide, critical appraisal, again, is to place value, to consider in a comprehensive way. The steps to a critical appraisal for each keeper study. So now you've done your literature search. You may have come up with 10 articles on your content, and you want to look at determining whether or not you're going to keep those articles, or how many of those will you keep and the other ones you will lay aside. So you need to first of all determine the level of evidence of the study, that's that hierarchy, and appraise it for the quality. And there are steps that we'll look at in determining the quality. So there are 3 key questions in a critical appraisal of a quantitative study. First of all, you want to find out, is it valid? Is it close to the truth? Was the rigor of the design and methods good? And oftentimes what you'll be using is a format or a table to answer questions. And there is one that will be available on the website here through the center. And you go through, and if you're able to answer yes to all of those questions, for example, if it's a random controlled trial, were the participants randomly selected? If you can answer yes to that, that's good. If you can't answer yes, you'd have to question why or why not. Are the findings reliable? That's very important because you want to know, are they clinically significant or statistically significant? Oftentimes, a study might be only clinically significant, which is good because you can still use it in the clinical practice. Statistically significant actually looks at the p-value. And what effect will it really have on the intervention? And therefore, you're going to be looking at the confidence level. And can I use this in my practice? Does it include the population I'm looking at, the intervention, and the outcome? Okay. So key questions in critical appraisal of a qualitative study, validity and reliability now is looking at trustworthy. Can you trust the results? Are they believable? And that is the rigor of a qualitative study. It is not using numbers, it's using themes, and does it make sense? And can I use those findings in my practice, and will it apply to the population that I'm studying? Ultimately, will the studies help me in caring for the patients? So after you have gathered the data, you have appraised it, and you've determined the articles, the research, and evidence is valid, is reliable, is trustworthy, and it follows the flow of research, you ask yourself, will it help me in making a decision in caring for my patients? And here are the final references that have been cited throughout the presentation.